Good evening, everyone. My name is Elizabeth, the Education Coordinator for Marlene's Market and Deli. Tonight's special guest that we have with us is Dr. Linda Huxtable. She's a naturopathic doctor, and Shanna Rivera. She is a certified thermography technician, and we are super thrilled for their topic of the lymphatic system and thermography. Thank you so much, ladies, for joining us.
Thank you for having us here, Elizabeth.
Anytime.
All right, well, I'll get started here tonight. We're going to talk about the lymphatic system and medical thermography. And my company is called Flowell, and Dr. Huxton is with the Medicine People. So there we go. A little bit about me. I founded Flowell in 2016, and I became a certified thermographic technician in 2011. I've also been a trainer for PACT. PACT is the Professional Academy of Clinical Thermology, and I'm a proud member of Breast Thermography International, and they do an excellent job at helping us to educate patients about medical thermography.
And I am Linda Huxtable. I founded Medicine People Medicine People is a more recent company, but for many years, I've been practicing in the health and wellness space, and I've been a functional practitioner. My education was a mixed education, Yale, Clayton School of Natural Healing, the Rolf Institute, and it included studying under many very famous people, including Dr. Rao and Dr. Klinghart and Hal Huggins and many people along the way. So I've been reviewing thermography for over 30 years since the pictures. I saved some of the older scans, and they're really kind of funny to look at. You look at them and you think that you're looking at a cartoon, and even way back then, we were able to tell something, not as much as we are able to tell today, but I just can't get over how clear the good company that we worked with, PACT or BTI, the imaging is. It's extremely helpful, and we're going to talk about some of that tonight.
So to bring thermography to a location near you, for my company, Flowell, we work in 4 different states, and we're not opposed to traveling to a location if somebody has a request. And there's lots of BTI members, Breast Thermography International members throughout the country that provide excellent top quality imaging and reporting. And then Dr. Huxtable's practice is a telemedicine practice, and she services clients worldwide. And so some of them have traveled to us in Florida and even Washington to get their scans from out of the country. So we even help people, figure out what airport to fly into, where to stay, because people come to see us from all over to get these thermography scans. And it's wonderful that Dr. Huxtable has this telemedicine practice, because patients have access to her anywhere they are in the world. All right, so for tonight's topic, we want to find out who really knows about their lymphatic system. So I don't think you guys can see the chat box that I have up on my screen, but Dr. Huxtable and I can see it. So just go ahead and type in the chat box. You have to hover your mouse to the top or the bottom of your screen to have the chat box pop up, and just type yes or no if you truly know about your lymphatic system, or if this is the first time you're getting educated about it. Many people are familiar with it, and many people are, just maybe think there's a couple in their throat when they get sick and those get swollen. So just let us know so we have an idea there. And then Dr. Huxtable is going to take it away with educating us about our lymphatic system.
So on the right of your screen, there's a little diagram of your lymphatic system. And this is a kind of simplified diagram. The lymphatic system is we used to think it was a closed system, but as we have learned more, we understand that the dural tube, which circulates the lymph through the brain is an open system, and it is interchangeable with the lymphatic system. So the lymphatic system is really important, and it's your systems, it's your body's way of getting rid of waste and toxins and unwanted stuff that collects in your body that we get from our diet, our lifestyle, the environment, everything, our food, everything. It goes into the lymph system. It's part of the detox system, and it also helps collect things and put things that are needed into the blood. And keep going, Shanna. We'll see where we are. See if we have a next slide. Oh no, we skipped over to this. Do you want to talk about that, or do you want me to?
I want you to talk about this one.
So inside the lymphatic system, you've got these lymph nodes where the lymph collects to help detoxify your body from viruses, bacteria, anything that doesn't belong there. That's called the lymphocytes. They collect there. They actually collect in the lymphatic ducts or the lymphatic nodes. So I think many of you might have an experience when your kids get sick. You feel under their maxilla, and you can feel if the lymph nodes are swollen. Well, guess what? When the lymph nodes are doing their job, they are swollen. And when you have chronically inflamed lymph nodes, it means that you have a chronic infection and you have a chronic inflammation, and then the lymph nodes can get scarred, and we don't want that. But on this picture, what we see what's called the gray scale, which is represented you get pictures called rainbow, and you get the gray scale. And the gray scale, we can see lymphatic congestion in both. But this is a good picture because it shows, I don't really can't point on this. It shows along the line of those arrows. Yes, there you are. Where that's draining, probably from an infection in the mouth, as Shanna just pointed out. The mouth is the portal to the rest of the body. That's the truth. And unfortunately, the dental practices are not that interested, have not been interested historically in using dental substances that are safe for your body. They've used very toxic things like mercury, like dissimilar metals, like nickel, like aluminum, like BPA plastics, all kinds of things that aren't good. Well, the mouth has areas for lymphatic drainage, and the mouth also has lots and lots and lots of blood vessels that will carry these toxins and the infection into the rest of the body. And so in my very early training, we're talking about many decades ago, what I learned from working with teachers like Dr. Rao from Paracelsus out in Europe was that, which was a cancer clinic, was that if you don't clean the mouth up, guess what? You're not going to get better. Okay, so he taught us that I remember him telling me when I would send patients to Paracelsus for a Hail Mary treatment, they were end-stage cancer patients, and I needed more done for them than I could do in my clinic. He called me up one day and he said, please don't send me any more people that haven't had their mercury out and their root canals out and their cavitations. And this was before anybody even was aware of this, dissimilar metals in their mouth. And now we understand that we also need to restore the microbiome. He said, because what we're going to do is we're going to send them to the dental clinic that is associated with the Paracelsus, and we're going to clean their mouth up first, because we don't try to cure people of anything until we get their mouth cleaned up. So I learned that so many decades ago that I can't remember a time when I didn't know it. Now, I think as a child, I probably didn't know it. But when I was in my early 30s, it began to dawn on me that one of the reasons I was sick all the time was from the time my parents dropped me off at a dentist, and in the next town, there were 6 kids. I was the oldest, and he filled my mouth full of the worst neurotoxin known to man, which is called mercury. And I went from having a photographic memory to struggling just to keep awake. It was quite a difference. And fortunately, I didn't have internet. I went to a one-room schoolhouse. I didn't have anything, but I figured out through a great connection with my creator that I had better get that mercury out. That's all I can say. And I did. So go ahead, Shanna, let's go. We'll keep going. And that's how I made the early connection between the mouth and the body, was through my own experience. And remember that your bodies are your best laboratories. So there's a lot that we don't know and that we learn all the time, but you can find it out. You can figure it out if you're aware and awake.
And just to comment on this picture, it's rare to see this distinct line going from the mouth all the way into the breast. Usually it's more dispersed heat coming down from the mouth and the neck, but so this is probably a major infection.
And that's vascular inflammation that we're seeing, or lymphatic inflammation. It could be either, but as we go, we'll talk a little bit more about it.
Okay, so here, this one's for you, more on the lymph system.
Yeah, so the lymph contains small amounts of nutrients and oxygen. It contains abundant carbon dioxide, and it takes metabolic waste out. So, it's interesting to think about the brain and the dural tube, because things cross the brain-blood barrier. And how would your brain get cleaned out if it wasn't for that dural tube and that? We didn't know this. The fluid that goes through the brain and cleans the brain out and goes back down the spine through the dural tube. We didn't know that it was an open system, and that was part of the lymphatic system. But looking back, it makes sense that it does. So the lymphatic system has a high concentration of specialized white blood cells called lymphocytes. And it helps to clean your body out from your brain on. And when people get cancer, it's so interesting because they think that they were a victim and all of a sudden they got struck by cancer. But we know very much better. We know that you are in the catbird seat. You're the one that has the ability to monitor what your body's doing and monitor your micronutrient intake and your the amount that's getting into your cells and the condition of your cells and your Krebs cycle. And you are responsible, not a victim, but you're responsible completely for whether you get a degenerative disease or not. And we can help you to learn how to avoid that. And the lymphatic system and thermography is a great tool.
Key components. So this was one of your patients, right, Dr. Huxtable?
Yeah, this was an interesting patient. So you could probably tell from the picture that she has one breast implant and that it's a very old one. And she lived in a state that is extremely restrictive. And just looking at the lymphatic congestion, supraclavicular over the clavicles, and the drainage down into that left breast, this, by the way, this scan saved her life. She lives in another state far, far away, and I'll show you in a minute why. But let's keep going. And she's very uncomfortable. She hates that implant. And we know now, as we knew many years ago, decades ago, that breast implants leak. They all leak. 100% of them leak. You're getting silicone into the body where it doesn't belong. You're getting fungus, yeast, mold, everything. They're very, very, very toxic. And years ago, when I would send patients to a very famous cancer specialist in California, he didn't even know. He knew how to do IPT. He was an RGCC practitioner, but I began to educate him about breast implants and about breast implant illness. And he never said a word. And now he's gone the other way, and he does not even treat patients with breast implants. So go down and one more.
So you can see the left breast here. I had someone private message me requesting to use my mouse. The left breast is the one with the implant. And up here by the clavicle is where it looks very congested, leaking down towards the breast tissue. To me, this right armpit looks extremely congested as well as the left, but definitely more so the right. And then one thing that I've discussed with patients about implants is it's a foreign object in the body, and the immune system is busy all day long trying to get it out. And
Yeah,
so
and
the
this-
immune system neglects other areas of the body because of that. Would you agree?
Yeah, and just look at the asymmetry of this poor woman. I mean, you just can't imagine a healer doing this to a human being. But look at the lack of symmetry and the weight of that left breast. And you know, one of my patients just recently told me, she's a very small Asian woman, and she said that the surgeon sent her home with the implants, and she might weigh 98 pounds dripping wet. And when she held the implants, she began to connect with the fact that it was pulling her down all the time, 24/7. And just the weight, just the physical weight, she became really sad and saddened that she hadn't, and all of the inflammation in her chest and her arms that she fought with and really never attributed to the breast implants, it all went away. It all went away. We had this conversation because she was my patient a long time ago, 22 years ago, when I first diagnosed her with cancer. And it took me all this time to get her to get the breast implants out because she was so self-conscious about her lack of breast tissue and the difference that the breast implants made. So it wasn't only a conversation about health, but that was primarily on my mind. That was totally on my mind, was her health. It was for her, it was much more of a conversation from an emotional point of view. And I can tell you, you know, she had all kinds of plans to get fat implants, get the breast tissue built back up with fat and everything. She is as happy as can be today. She's just thrilled that she went and did it. And she's adjusted completely to her new image.
Wonderful. Okay, here we go. More information here about the lymphatic system. No,
Yeah. Go back. Yeah, most people don't know that we talk about the lymphatic chain, especially in men or in women who have ovarian cancer. But if you've got prostate cancer, there's what we call a lymphatic chain made up of lymph nodes that are all connected in the pelvis. And so most people don't realize the extensiveness that the lymph has, the capillaries have, and the job that they do. And when I see people with who are edemic, especially in the feet and the legs, what they do not realize is that the action of the ankles is the pump for the lower lymphatic system through the legs. So people who are sitting all the time and people who don't get their feet up over their head, which is why everyone should do yoga if you can, because you put your feet up over your head. If you can't, just putting them up above your head, like on a wall or something like that, helps to drain the legs. But so many people have edema and no way to get rid of it, and they don't understand that walking or yoga or anything that gets their feet up. There's a great little machine called a yoga a tool called a heads up. And it's very easy. Anybody could do a shoulder stand, heads up. No, feet up, feet up, feet up, it's called. Anybody can do a stand on their shoulders, holding on to that and learning how to get their feet up in the air. So if you have neck injuries or different injuries, there's all kinds of things. There's waterfall, which are you lay on your back and you could put a block under your pelvis and you stick your feet up into the air, or all kinds of things, all kinds of ways to get your feet up. But either the feet, ankles have to move, or the feet have to go up over your head on a wall or straight up, like in the position waterfall or in plow. What are some of the other ones, Shanna?
I'm just thinking of the yoga trapeze and how that's great.
Yoga trapeze, the yoga body trapeze. Yeah, there's all different ways. Feet up, to get those feet up over the head, get them up over your head.
Oh, Elizabeth put the link in the chat for everyone. Thank
Feet
you.
up. And also, Shanna, you want to talk a little bit about skin brushing?
Yeah, that's one of the tips that we have tonight. So you can get a dry brush, it's called. And before you get into the shower, when your body's dry, you brush in the direction on your body, everything towards your heart, to get the lymph cleared out and get it flowing. And you just do it for a few minutes before every shower and helps to stimulate the lymph.
Yeah, another great, we talk about the lymph a lot, and we probably don't go through the importance of keeping it moving and the stasis that we see in lymphatic congestion. One of the things that I think I did a short video of is when you're in the shower, to move the lymph, it's a very gentle motion. You can just start stretching this platysma, this big sheet of muscle, or just use very light strokes down your neck. And when many times a week, I will just drain these lymphatic glands under this bone here is called the mandible. I'll drain them, and if you start working that, you'll feel it drain. You'll feel it drain. That you could do so much with your own hands. You could do a lot. Move your wrists, move your ankles, move your legs. Keep moving.
Keep moving. Absolutely. So this is the same woman that we were looking at before, but the oblique and the lateral shots.
Yeah, so there's a lot that we see because we see a lot. And so this is called the rainbow scale. And if you look up, we know the temperature of this room or this scan was 36.1 degrees, 36.0 degrees centigrade. And the gray scale is gray, and the rainbow scale, the little bar to the right of it, is the key to what the temps are. And there's a team of thermographers, which other companies don't have. They don't have the resolution. They don't have a team. There's a team of thermographers that look at this, and pardon?
Thermologists are the interpreting doctors.
That look at this and that record these numbers that we do use. You can see up in the image zone, minimum delta T max, delta T max. You can see numbers of that correspond to the little on the top left. I keep trying to point, I can't do it. The top left, you see 1 and 2 there. That corresponds to that's right. So that's not right. 4.
Right here, they're taking, sometimes they do this. They take the temperature points right next to one another to get the delta T average. So they're comparing down here, zone 1 and zone 2, and then 3 and 4.
Yep, that's what they did there. So keep going down one more, because this is an interesting patient. Go down to where her belly is. I'll show you what happened. Keep going. We'll go back up.
Okay.
Oh no.
It's a bit of ways. But...
Oh, never mind. We'll talk about that later. Go back up.
Just kidding.
Oh gosh.
So up next was our lymphatic detoxing list. So I wanted to get a list together for everyone. Feel free to grab your phone and take a picture of the list so you don't have to jot it all down. But First off, schedule a thermography scan to see what areas of congestion you can address. A really big one, and we're going to see some thermography examples here coming up, is, women wearing tight bras or men wearing tight belts. Sometimes I see tightness in women's lower abdomen as well with the tight belts. But if you have any clothing that by the end of your workday, you're ready to take it off because it's hurting you literally, then stop wearing it. You need to, buy bra extenders, buy the next size up bra, remove underwire. Underwire is not good for us, whether it's hurting you or not. It's a solid piece of clothing digging into your body all day long, every day. If you need more convincing than me or Dr. Huxtable, I've heard her mention many times to change bra styles. There's a book out there you can read called Dress to Kill. And it talks about in societies where women wear bras, breast cancer is very prevalent. And in societies where they don't wear bras, there's like 0 breast cancer. And before this, Dr. Huxtable and I were talking about the stats that you're going to see in a minute, but it was 1 in 8, probably when I first started doing this about 10 years ago. And, we're thinking it's down to 1 in 4, Dr. Huxtable. Is that what you were saying?
I think it's about 1 in 4, between 1 in 4 and 1 in 5 now. The rate of cancer is 1 to every 2.5 people. But that includes all cancer, but we see a lot of breast cancer.
And so like you were saying earlier, Dr. Huxtable, don't be the victim. There's easy steps that you can do to change your health and your future. Don't wear tight clothing. Don't wear toxic deodorant. Get your thermography scan, see what's going on there. What can you address now that you can turn around before it's an issue that could show up on an anatomical test? Let's see, sweat. I can't even count the number of times, Dr. Huxtable, I've heard you say, patients need to sweat on a regular basis. Be well hydrated, good quality water, take electrolyte supplements afterwards. All these things are helping your lymphatic system, helping you to detox your lymph. You can get on a rebounder. If you have a little trampoline or even a big one, just 10 minutes a day, jumping very lightly on it can really help to open up the lymph, and then drink a lot of quality water afterwards and flush everything out.
And I'm glad you put an exclamation point after that, sweat, because people don't understand that by saying you need to sweat profusely when you sweat. You need to be drenched, like somebody dumped a bucket of water over your head. When I ask people if they sweat, and 9 out of 10 cancer patients say, no, I don't sweat, or they say, I glisten. That's not sweating. That's not sweating. Sweating is just being drenched. An infrared sauna, radiant heat yoga. There's all different ways. There's all different ways that you can do it. But infrared sauna is an easy thing to have in your home, and makes it very convenient to sweat inside of an infrared sauna.
I see a question in the chat here. Somebody asked, what is the blue at the bottom of the other breast without the implant? So she's talking about right here. And that's just a colder area of the breast tissue. So there's not as much blood flow in there as, up here, it looks inflamed with this yellow and this red. The top of her breast is unusually hot. Since the breasts stick out of the body, it is common to see them colder, especially if somebody's not really active and doesn't have a lot of breast muscle. And then there's someone on tonight, Barb Henniger. She posted in the chat. She's actually a Ruby Ribbon representative, which is a bra company. So it's, excellent. And Barb, why don't you put your information in the chat right there so people could reach you? But there's Ruby Ribbon, there's Soma bras, there's Cloud9 bras. There's quite a few different bra styles out there. That there are bras without underwire that still give women excellent support, and they don't squeeze you in one area. Look at this woman's line right here. You can see she wears a bra that's too tight. And my guess is because of the uneven breast tissue, it's pulling more so on that side for her.
Yeah, but, you could see on the right side where that little tail goes by the red, which that nothing, this is not a normal looking scan at all. But you know, what Shanna's telling you is exactly what we would probably tell her if I hadn't been so focused on getting her to the hospital. And we'll show you that in a minute. But definitely you get this the lymph system cannot work if you've got tight clothes. It can't work. You're going to get lymphatic congestion. You're going to get this red hyperthermia. Some places the red is normal. Like somebody just asked about the blue, you know, you really want your breasts to be more blue than anything else. But some places like under the armpits, that's called the axillary space, under the breast, if it's a heavy breast, it's going to be red. This is not normal. This is not a normal scan.
Okay, so what makes thermography so popular? And I would say it's because of breast cancer awareness in our country and how heavily mammograms are, you know, they're just driven in October and throughout the entire year, really, to make sure everyone's up to date on their breast cancer screening. And so many women are frustrated with the compression or the radiation, and they call me and say, I'd love to come get a thermography. You know, I don't want to get a mammogram. And I have to educate them that, you know, it's considered an adjunctive screening to anatomical testing. And anatomical testing could be mammogram, ultrasound, MRI. Ultimately, it's up to the doctor-patient team which test they get. We'll go over the differences of those in just a bit, but some more stats. There's over 40,000 deaths every year from breast cancer. 80% of breast cancer patients do not have any family history. That's another phone call I get quite often. You know, someone will call me up and say that a family member has cancer and now they want to get their thermography. Well, if 80% don't have any family history, that means everybody needs to get checked, you know, and with this safe, valuable screening tool, it's a great way to see what's going on. And then 1 in 833 men would be diagnosed with breast cancer. I'm sure that number's just like the other one has gone down over these years. If someone does get cancer, it's the uncontrolled proliferation of cells in the body. Cancer cells are in all of us, but normally our immune system is functioning optimally and it can keep those cancer cells in check. Cancer doubles on average every 90 days. And so in your thermography report, you probably saw a follow-up recommendation of 6 months. If there's an extreme finding, it would be 3 months or 1 month, or, you know, maybe you got a year follow-up recommendation, but it's because of this statistic here, cancer doubles on average every 90 days. So if there's some areas that we see that are, you know, a little bit abnormal, we want to see what are they doing in 3 or 6 months time, you know, if cancer doubles on average every 90 days. Because cancer goes through a process called angioneogenesis, where the precancerous cells are floating in the body, the immune system isn't working, so they can latch on to our blood supply and gain nutrients, and then the cancer tumor can grow, doubling on average every 90 days. And our blood is hot, so it's a concentration of blood in that area, and that's why we look for heat in thermography. Here are the different screening methods. You know, mammogram has the compression, it's an X-ray. Ultrasound is high frequency sound wave imaging and safe for adults. MRI is magnetic imaging. It's actually therapeutic for our bodies unless it's done with contrast.
Exactly. Gadolinium is what it's called.
Gadolinium, and that actually can cause cancer, is that right?
Gadolinium causes the body to accumulate heavy metals in different parts of the body where they're not supposed to be, and the heavy metals are cause cancer. Inside of a cancer cell, there are 100,000 times the amount of heavy metal as outside, like a tumor, inside a tumor. It's 100,000 times the heavy metal, the mercury, as outside of that tumor.
Wow. And then with thermography, it's high resolution infrared photos, or images of heat. So we're simply analyzing what's unusually hot or unusually cold in the body. And just because someone has a hot spot does not mean it's cancer. It's more likely that it's toxic buildup or hormonal imbalance or something due to injury. But if those things are present, then the patient should be working on those things so it doesn't fester there for years or decades and eventually could result in cancer. So mammograms and ionizing radiation, 80% of the biopsies that come back from them are negative, and 20% of mammograms are false negatives, meaning 20% of the time a woman gets checked out with a mammogram and she thinks everything is fine, but there actually is undiagnosed cancer. Mammogram guidelines are being challenged at this time. They're saying it's too much radiation for women under 40, and should they move it up to 50? And they made that recommendation up in Canada, several years back. So for thermography, we use it for breast cancer detection. We also do one of the most important ones I think that we have is the cerebrovascular screening, where we check the blood flow that comes up on the carotid arteries going into the brain. The blood travels up into the brain through veins on the forehead right here and here. They're called branches of the supraorbital arteries. So if one side of your forehead is significantly colder than the other, it could indicate blockage in a corresponding carotid artery. And if caught early, somebody may be able to do something about it and avoid a stroke. Thermography looks for hormone imbalances. We give a spine analysis and much more. And so with thermography, we detect physiology instead of the anatomy. So a couple days ago, I had someone call me and say they wanted to analyze their lymph node. They wanted the report back so they could analyze, is the lymph node cancerous or not? And I said, we can simply tell you if there's any heat in that area or not, and then it would need further testing. She said she wanted to go to get a biopsy, and I explained a little bit about the RGCC test, which Dr. Huxtable mentioned earlier. I don't know if you want to touch on that a little bit, but in explaining about how you're an RGCC practitioner, Dr. Huxtable.
Yeah, that's a test that we do. We send blood degrees. So today we had 2 of them go out. But we have 100% success rate with a positive diagnosis. So if RGCC comes back and says you have cancer, you have cancer. We have about a 98, 99% success rate saying with a negative. So if it says you don't have cancer, you still have a very small chance of having a tumor like in the brain that's very well encapsulated and not putting out CTCs, but it is the most accurate test in the world by far. It's something you can hang your hat on. You could just bet your life that it's going to be correct, because it is. So one of the things that we know is that the CTCs are in the blood and in the lymph years before, sometimes years before there is angiogenesis, or there is blood vessels that have formed enough to support the growth of a tumor bigger than a BB. So the lymph nodes are going to be positive, and just like your hormones and like lots of other things that God gave you when you were born with lymph nodes, because, as I hope this presentation has shown you a little bit about, they have a big function. So taking them out, cutting, burning, slashing, drugging, radiating, all of that is not ever going to cure disease. You have to cure disease by figuring out what's wrong and going back and removing it and giving the body what it needs to heal itself. That's how you cure the body. Drugs deficiency is not a disease, is not a deficiency of drugs. Never has been, never will be. Okay, that's not how you're going to be able to cure yourself. You may live a little bit taking a drug, But are you going to have quality of life? I listened to a webinar this week or a couple weeks ago, Dr. Weiss from Atlanta, Atlanta, said that each drug has at least 300 side effects, and they do not have to put them on the internet when you read the side effects. And when you combine two drugs, you get an incalculable number of side effects. So, and one of them is that it depletes you of magnesium. That's just what it does. It depletes you of magnesium. That's just one side effect. So, we try to focus on what is going to help you to avoid getting sick. First of all, we want to avoid you getting sick. And then if you do get sick, we try everything that we know how to do to teach you how to get yourself well again. That's what we do.
Have that war chest stocked up, right?
Yeah.
So another point about thermography is it's safe at any age. And I'm really surprised that more parents don't take us up on this, but several years ago, I heard one of our interpreting doctors started screening kids in his clinic for free, for current patients, and scanned about 45 kids in his clinic, and they found breast cancer in an 11-year-old.
Yeah. Yeah.
And so after hearing that, I was like, I need to adopt that policy as well. And, I offer free screenings for kids if they're 16 or under a current patient. Because I see, and since I only get like a handful every quarter or so, but since I started doing it, I'm seeing the same things in kids as I do in adults, like lots of mottling patterns, which is, they almost look like leopard spots on the body. I'll point some out here in a little bit. There's also, areas of inflammation that need improvement that I wish I had thermography when I was a kid. I might have been able to avoid some health issues that I dealt with myself. But, if the parent can get a review with someone like Dr. Huxtable, they can get some excellent knowledge on what they could do for their kiddos so that they can get through puberty and young adulthood and as healthy as possible. So getting into some case studies here, we have a patient who's definitely wearing her bra too tight. You can clearly see on this inverse grayscale image down here, this dark line right around here. So I know some of the styles that I mentioned, Soma bras and Cloud9, as well as Ruby Ribbon, they're using like a thicker band on the side that's not just one tight elastic on the bottom of a bra. Even if this woman wore a thicker band, a lot of the bras are made with one tight elastic on the bottom. And that's just not good for us. It's blocking her lymphatic system. It's literally congesting her breast tissue with toxins by not allowing the lymph to freely flow and push out that stagnant waste that we don't need. And you can see coming down from her armpits here on both sides, all this red congestion. It needs to go. She needs to do some body massage, some lymph work. Thank you, Elizabeth. I saw that you posted in Tacoma, Washington here. There's a woman named Nicole Rith. I guess she was a presenter here a little while back. She does some lymphatic work. So it's great to find a good lymph specialist in your area to help you clear this up if your thermography is showing this is an issue. And then that toxic area won't fester there for a long time. And then eventually a problem could develop. So Dr. Huxtable, this is back to your patient here who had the implant, and you've got the lateral shots in the inverse grayscale, anterior, inferior shots, or underneath the breast, and then the face. If you want to talk about these a little bit.
So you could see that on the left side of her face, she has that line going down. And looking at her thyroid under her chin there, that little area right there, that is definitely infection from her mouth hitting her thyroid. And it's interesting that you see the blue above her lip on the right side of her face and the blue on the side. when I have patients that have TIAs, that's a little blood clots that affect the brain, it's usual that I see one side of the face or the other more blue. We're going to actually see somebody later that's got a lot of black on their face. The black is very, so her fingers, you could see up in the middle scan, are very hypoxic. There's very little circulation. If you look at the key to the right of it, that is getting to her fingers. Her hands are cold a lot, and she has hypercoagulation where the blood sticks together and doesn't get into the capillaries in that area of her hands, which you hope to not see. Unfortunately, we see a lot of people in the same situation. Go down one more, Shanna. No.
This is another slide. This woman has
Good one.
inflammatory breast cancer, which can be very fast progressing. I believe there was 3-month intervals in between these 3 scans, and something that mammography cannot pick up on is inflammatory breast cancer. This is a different patient where she improved her before and after scan. The delta T numbers were just borderline with 1.78. The threshold is 2. The highest number, I'm sorry, that's 1 and 2. That's, yeah, even down here, I was looking at this area, but anyway, you can see the heat and color, how much it has dissipated at her follow-up scan. So this is what we love to see. This is this patient's hard work paying off, getting rid of that inflammation.
On the top there, go back up one where you were before. You see the on the right of your screen in the grayscale. Well, she has it on both breasts, but it resolved a lot in the bottom. You could see the kind of circular, it's called the suspicious pattern of vascularization, where you see the blood vessels through angiogenesis have grown into a circle in order that, and that's one thing that we look for, that when patients get breast cancer, is that they have that develop first. And she's got it in both breasts, but whatever she did, she worked hard and she really got a lot of changes. And that's what can happen. It's a great scan.
Agreed. And so this is a patient who did not improve. At her, this top row here is her baseline scan with us, and the bottom one is the follow-up. And you can see, the nipple area got a lot colder. Black is a colder color. The armpits got a lot hotter in all these scans. So, we talked about lifestyle changes and what she was and was not doing. And hopefully at her next scan, we'll see things not only go back to the way they were, but, improve from even this first scan by using this as motivation to make some lifestyle changes. So this is that same patient that we saw before, the oblique or the lateral views of the face and the thyroid shot.
Right, you could see on the upper right-hand side of the screen, the infection that is in her mouth draining down into her neck, into the, that's what people often tell me. Well, my mother had thyroid problems, my grandmother. No, you probably all had mercury in your mouth. It's because we all live so much alike. We all do the same things. We eat the same foods. We do the same things. It's not genetic. Only 2% of diseases are caused by genes. You're not a victim of your genes. And in the lower one, you can see very well under her, that infection on the left-hand side draining down supramandibular there under her mandible, and it goes right down and knocks that thyroid out.
This is a case study where the thyroid screening improved, the lymphatic congestion improved. I know this patient worked pretty hard doing some oil pulling and lymphatic work to get this to come down. I can't recall if she went to see a holistic biological dentist or not, but she still has this little bit of red. So she has come a long way. And if she did rule out infection and there wasn't any mercury or root canals, I would say, she just wants to keep doing what she's been doing to see even more improved results at the next scan. This one was oral inflammation that improved quite a bit. But there's always a certain order that patients should do things in. If somebody has infection in their mouth, they shouldn't start with lymphatic work. First they have to go see a well-trained dentist. Holistic biological dentistry. There's Elizabeth just put in the chat, Carla Yamashiro. She's at Ecological Dentistry out in Bonnie Lake, Washington. And Dr. Huxtable talks to holistic biological dentists, and so do I all the time. We actually just had a Zoom meeting with one last week out in Portland, Oregon, to interview them and learn about their practices to see if there's somebody we want to refer patients to or not. And sometimes it's challenging finding a really good one, but there's Dr. Cintron in Fort Lauderdale. There's Dr. Porcelli up in Bluffton, South Carolina.
Nunnally in Texas.
And we interviewed Dr. Kelly, was it Blodgett in Portland?
Blodgett, yeah.
Yeah, and he was saying all the right things. So I think he's going to be a really good one too. So here's the back of the neck. Even oral inflammation can affect all the way to the back of the neck, and it's a great representation that what happens in the mouth doesn't stay in the mouth. It can affect the entire body. This one was the front of the face, where the front right forehead here is black. So we were talking about the cerebrovascular screening earlier, and this gentleman, he wasn't getting any blood flow up to the right side of his brain. It was actually due to a squamous cell carcinoma on the right side of his neck, and a remedy that he was doing to kill that tumor. It was also eating away at his carotid artery. And so this guy went through a lot, this poor guy, and, ended up passing away from a stroke shortly after the scan. And this wasn't my patient, but I have never seen one of my patients have black on the skin on their forehead. The eyebrows are normal, that's hair. It's not normal to have a jet black nose like this. I would say it's an abnormal finding, but it is actually more normally seen. But Dr. Huxtable, maybe you could talk a little bit about that, the black noses that we see versus when we see lots of light blue color come back into them.
Yeah, so one of the things that I noticed a long time ago was that when people came into my office, I would see their nose, and I would focus on their nose because it was like a blue or a gray color. And then when I did a lot of thermography, what I would see is those people have black noses on the thermography scan. And what is black? Black is avascular. So where do people get cancer a lot? I had a patient today that had 3 squamous cell episodes on her nose. They get cancer in places that are hypoxic, that don't get oxygen. That's why it's very rare to hear about cancer of the heart, right? Because why? Because it's so well oxygenated. But it is not normal to not have, it makes me want to feel my nose. It's not normal to have a black nose. And we do all kinds of things to try to turn that around when we see it, including Beamer, the B spot over the nose, all kinds of things to try to get circulation back in the nose. Every once in a while, I do grab my nose and wiggle it around a bit and try to get it blood flow back in it.
Yeah, massaging the face.
Huh?
One of our locations, Nourish in Boynton Beach, Kristen, the owner there, she teaches people how to do face massage on a daily basis when you put on your moisturizer. Everything needs to get moving. Exactly. Here's one of the kid scans that we did that you can see the inflammation in the neck reduced at the follow-up. You can see the hips evened out. His right hip was higher on the right. Abdominal inflammation, I always tell patients to ask their doctors about the underlying organs over the area of inflammation. This patient had quite a bit. We're just running short on time here, so I'm going to keep going. And then this is a case of melanoma. This patient came in for a breast scan, but her thermographer convinced her to get a health screening. And without that, she wouldn't have even known this was on her back. I've seen this one in another case of melanoma that to the naked eye, it just looked like a small vein. It didn't even look like a strange mole, like I would imagine a melanoma to look like. The arms and the hands tell us quite a bit of information. I would say these are normal findings of the arms or the hands, but sometimes maybe not this. The thumbs do look a little bit.
Yeah, the thumbs, but they're like 100% better than what we see a lot of.
Yes.
Which is black or purple fingers.
Mm-hmm.
Sometimes you don't even see it. Looks like they don't even have any fingers.
Well, that's like if we're scaling for the torso, then they're going to look black. But I do see, you know, when we do the torso shot, I see hands that look like this that have really good circulation, and then just most people don't have great circulation, and that's why most of them are black, because the images are not scaled. So when you see these images of the arms and the hands, sometimes you'll see the back looks totally red or even white hot. And that's because our interpreting doctors have to change the scaling of the image just to be able to see the arms and the hands because they're so darn cold. This was a chiropractor I work with, and he ended up spraining this right ankle a couple weeks after I went over his thermography. And, you know, had he really worked on that ankle, he might have been able to avoid that sprain. I don't know. I know Dr. Huxtable and I were talking about this shot earlier, and it's quite a bit of inflammation there. So I wasn't surprised to hear that he sprained his ankle, but I just wish that he had been proactive with, you know, some chiropractic adjustment on the ankle or massage work or something to avoid it. So here's the whole thermography process. Starting tomorrow, we do require a doctor referral to get your report back, and you would fill out your intake forms, review the important patient protocols. At the appointment, we discuss acclimation. Your reports are going to be ready in 3 days if it's urgent, or 1 to 2 weeks if it's not. But they're usually pretty fast. It's usually about a week. You get a consult with a doctor. It can be a referring doctor. You can bring it back to your doctor, or you can consult with a doctor who I recommend if you don't have one. Dr. Huxtable does a lot of consults with my patients because she is really well-versed on how to speak about thermography, and she's been using it in her practice for over 30 years. And she does an extremely thorough review. So she goes over the thermography, she goes over any current lab work a patient will have in an hour, and then she sends them some session notes, and then they get to take those into consideration and work with her going forward, or work with another doctor. It's totally up to each patient, but I do have quite a few patients who have benefited from your counseling, and thank you for that, Dr. Huxtable.
You're welcome.
And then I do a second phone report review with patients. It just serves as a follow-up. I want to make sure they got their report, see if they have any additional questions for me, give them a brief review if they need it, and talk about the follow-up scan. This is my current pricing. It's actually going up tomorrow. So I highly recommend the full body to start. You use your full body every single day. So it's great to know what's going on thermographically. The next scan down is at least the torso. That's another great one, the health screening. If you want one region of the body, most common is the breast. That one is $249. And as I mentioned before, the kids are free with the exception of the interpretation fee. If they come on the same day, if they come on a different day, there is a little fee for that. Let's see. So lots of ways to save on thermography. If you sign up for your next scan today and today only, you can use this event code, event 50 off, and you get $50 off the current pricing, which is actually going up tomorrow. And, been a crazy world, right? With all the inflation and everything's just going up. And then Dr. Huxtable also agreed to do a discounted consultation for those who sign up today. So instead of $150, she's offering them at $125, and I would help you to set that up right at the thermography appointment. And she could also, fill out a form for you as your referring physician. This is my email, my assistant's email below, Isabel, info@flowell.org. If you want to learn about other ways to save on thermography, she can send that to you, but not in time to take advantage of the current pricing. So there's the United Breast Cancer Foundation, ubcf.org. They have a pay it forward program. We have a patient referral program. If you send anyone to us, you get $50 off for each first appointment there. So that's another great way to save. People use their HSA card, their FSA card. There's also more ways. So I think that's everything. Dr. Huxtable, did you have anything else to mention this evening?
No, I think you did a great job. It was a great presentation. Thank you for doing it, for the education, and thank you for you guys are the top company of any company that I know of, and I've tried a lot of different companies, and your scans are just heads and tails above anybody else's. I'm just so thrilled. One of the things that we didn't see was that patient who had the one breast implant. That scan saved her life. Did I tell you that story? I didn't.
No.
When I saw that scan, again, she lives in one of those states far away up north of me, and I had never met her. And she had breast cancer years ago. That's a very old implant. And she had been complaining a little bit, not very much, about stomach problems, not a whole lot. And when I said, you need to go get your scan, and she went and she had a scan done by some technician up there. And when I saw it, he said, you need to go to the hospital now. And she had a fluid. It's what we thought was and I'm still not sure because the phlebotomist did her cancer test wrong, didn't send in enough blood. It's never happened before. But she had a swelling on one side of her abdomen that I saw on the thermography scan that was huge. Hey, John. It was just huge. And it was so abnormal that I said, please go to the emergency room now, right now. And this was like a month and a half ago. She still isn't home. She had to go to rehab after. She would have died. There's no question in my mind. Her blood work, everything was so off. And she had tanked. I had just looked at her blood work. She had tanked so quickly as her abdomen filled up with this fluid. And so that scan saved her life. It really did.
I just love hearing stories like that. That's so great. I feel like the same thing happens with patients almost every day going over their thermography. And then when they come back and see me, they tell me about the changes they made. And it's super rewarding what I do, because that tells me I had a part in helping them head towards optimal health, which is part of my message. All right, well, this little guy's got to go to bed. So you guys all have a great night.
Thank you so much. Thank you everybody for listening.
Thank you so much. Good night.